I would want an entirely different experience from my consultation.
The benefit of this is that patients are sharing their stories with other patients.
Haemnet is a specialist research, communications and education consultancy working in the bleeding disorders community. Our aim is to engage, to communicate and empower.
Most medical research identifies measurable differences in large populations. We take a different approach because the p-values that we are interested in are people.
Get people talking about bleeding disorders.
I know from my years working as a haemophilia nurse that it is essential to understand people's real-life experience, whether that's as a person with a bleeding disorder, a family member, or as a healthcare professional delivering care, because it gives a greater understanding of what is important to them and what challenges there are. In our work, we combine quantitative techniques like surveys with detailed interviews. We've now used this mixed methods approach in many studies as it provides a rich source of real-life experience. One example is the Cinderella Study.
I had my first bleed when I was around 8. It was in my elbow. I thought I just banged it. I didn't say anything to anyone, and then my nan noticed. She was like, right, we need to call up the hospital.
For Cinderella, we surveyed women who live with a diagnosed bleeding disorder, those with immune thrombocytopenia and those who are carriers of haemophilia. This data was then complemented by in-depth interviews and focus groups. Surprisingly, we found that carriers were the least likely group to be screened for a bleeding disorder or to be seen in a specialist setting, even though they frequently reported symptoms just like the other groups.
All the women we spoke to reported difficulties in getting a diagnosis. There was a general lack of awareness amongst healthcare professionals and often poor communication between healthcare professionals and women. This contributed to stress and anxiety, with poor coping strategies and too few sources of support. Without a qualitative approach, we wouldn't have understood the extent or impact of these issues.
Rather than just publishing our research in scientific journals, we think it's important to communicate study results to the widest possible audience. The qualitative side of things helps here too. As we tried to do with all our studies, we turned some of the real-life stories we'd heard in Cinderella into powerful animations that we share on social media to communicate our results with more impact.
We launched the Journal of Haemophilia Practice in 2014 because the major journals in the bleeding disorder field preferred not to accept qualitative research and case studies. By contrast, our journal is open access and gives healthcare professionals a platform to share their work. Their experience and insights are important and valid. That doesn't mean they get an easy ride. It is fully peer-reviewed, of course.
Hello and welcome to the Haemcast for World Haemophilia Day 2022.
Some people prefer to learn by listening rather than reading, so we also produce a monthly podcast, a good platform to promote debate and discussion about current issues in the world of bleeding disorders.
As we know, research enhances our knowledge of what needs to happen, but it's individuals and teams that actually bring about change. At Haemnet, we support people to close the gap between the publication of research and enhancing their practice. And we do this through knowledge sharing and providing opportunities to reflect on what it means for practice. We run conferences, educational courses for professionals, including a university accredited training programme, and we provide action-focused learning and leadership development opportunities.
We've also been able to combine some of our studies with supporting a research nurse undertaking a PhD. The Exigency study is looking at the motivations and barriers around gene therapy, which is perhaps the most significant recent development in the world of haemophilia. And we are now funding Agnes of the Haemophilia Foundation of Uganda to do a Masters in Public Health. Haemnet team members have visited Agnes several times to support her work, and we're always humbled by her achievements.
At Haemnet, we firmly believe that our approach benefits all key stakeholders in the bleeding disorders community, and that includes the pharmaceutical industry.
At Haemap Therapeutics, we are developing a treatment for people with Glanzmann's thrombocythemia. This is a very rare bleeding disorder, and we know little about how it affects people on a day-to-day basis. With their mixed methods approach to research, Haemnet has proven to be the perfect partner to work with us as we try to understand more of the natural history of this disorder.
It all comes down to really understanding patients' lives, communicating that understanding in ways that resonate with different audiences, and using it to empower professionals to bring about positive change in clinical practice.